Welcome to MedDecode, your trusted source for breaking down complex medical procedures into easy-to-understand steps. Today, I'm going to walk you through the lumbar puncture procedure step by step. Whether you're a medical student, a healthcare professional, or just curious about how this procedure works, you're in the right place. First off, what exactly is a lumbar puncture? Let's break it down in simple terms. Also known as a spinal tap, this is a medical procedure where I insert a thin, hollow needle into the lower part of the spine to collect cerebrospinal fluid, or CSF for short. This clear fluid surrounds your brain and spinal cord, acting as a cushion and playing a vital role in protecting your central nervous system. So why would I need to do one? What makes this procedure so important in medicine? The main reasons are to diagnose infections like meningitis, check for subarachnoid hemorrhage, investigate multiple sclerosis, or measure intracranial pressure. Sometimes it's also used to administer medications directly into the CSF, such as chemotherapy or antibiotics, especially when other routes aren't effective. But here's the catch. It's not always safe to go ahead. There are some important safety checks I must do before starting. I have to avoid lumbar puncture in patients with raised intracranial pressure, a local infection at the site, or a bleeding tendency. These are called contraindications, and ignoring them can be dangerous. That's because there's a risk of brain herniation or bleeding, and that's the last thing we want. Brain herniation is a life-threatening emergency, so safety always comes first. Now let's talk about patient preparation. This step is crucial for both the patient's comfort and the success of the procedure. I always position my patient in either the lateral decubitus or sitting position. The choice depends on the patient's condition and the reason for the lumbar puncture. The key here is to flex the spine. Think of curling up like a cat, to open up those intervertebral spaces for easy access. This makes it much easier to find the right spot and reduces discomfort for the patient. Alright, let's break down the steps. Here's how I perform a lumbar puncture, from start to finish. First, I clean the back with antiseptic and drape the area with sterile towels. This helps prevent infection and keeps the procedure as safe as possible. Next, I inject local anesthetic, usually lidocaine, to numb the skin. This step is important for minimizing pain and making the patient comfortable. Then comes the tricky part. I insert the spinal needle right at the midline, usually between the L3 and L4 or L4 and L5 vertebrae. I advance the needle slowly, feeling for a subtle pop as it passes through the dura mater. Once I see CSF dripping, I collect it in sterile tubes, one drop at a time, for analysis. Usually I collect several tubes for different tests, making sure to label them correctly. Now what happens to that CSF? Let's take a closer look at the next steps. I send it for analysis, looking at cell count, glucose, protein, and cultures. Sometimes we also check for specific markers or do PCR tests for certain infections. These results help me diagnose infections, bleeding in the brain, or demyelinating diseases like multiple sclerosis. The information we get from CSF analysis can be life-saving and guide further treatment. But every procedure has its risks. It's important to be aware of possible complications and how to manage them. The most common complication is a post-lumbar puncture headache. This can be quite uncomfortable, but it's usually temporary and treatable. Rarely, more serious issues like brain herniation, bleeding, or infection can occur, so I always stay vigilant. Monitoring the patient after the procedure is essential to catch any problems early. After the procedure, I tell my patient to lie flat for several hours. This simple step helps reduce the risk of developing a headache and allows the body to recover. I also encourage them to drink plenty of fluids, which can further help prevent headaches and speed up recovery. This simple advice can really reduce the risk of headaches. Thanks for watching, and I hope you now feel more confident about the lumbar puncture procedure. For more medical videos, don't forget to like, share, and subscribe to MedDecode. Stay curious and see you in the next episode.